Good afternoon. I'd like to thank Governor Florio for his leadership on this issue and our partners Dave Knowlton, Dean Cecilia Rouse, and President Shirley Tillman for making violence prevention a priority. The tragedy at Sandy Hook Elementary School was the most violent act against children that I've seen in my career that spans 31 years at the Children's Hospital of Philadelphia. At CHOP, we know the terrible toll that violence takes against all children in Muslim communities because we've seen it firsthand. In 2006, we treated a number of survivors from the shootings that occurred at the West Nichols Mine School in Lancaster County, Pennsylvania. 5 children were killed during that incident. Last year, there were more than 200 visits to our hospital related to violence. 129 children and young adults under the age of 24 died of gunshot wounds in Philadelphia last year. And gun violence is only part of the issue. National estimates estimate that more than 60% of children are exposed to some form of violence: child abuse, intimate partner violence, bullying, or community violence. More than 40% of children are direct victims of violence. These statistics are staggering. Renewing pledges to end violence is not enough. Now is the time for action. First, we need to expand the models that we know are effective. Much of our own violence work focuses on our local communities, where we have more than 50 care network locations, including 15 here in New Jersey. We offer a number of programs in the community that promote the normal development of children, and we invest heavily in this work. We have also successfully leveraged our research to create dramatic changes in policy and practice. We know that injury is the leading cause of death for children, and we seek ways to prevent it so that we can save lives. Our Center for Injury Research and Prevention has demonstrated national leadership in using evidence-based research to develop interventions that have saved the lives of countless children and teens, and to positively advance public policy on injury prevention. For example, our experts in the field of medicine, epidemiology, biomechanics, engineering, behavioral science work together to improve the design and regulation of vehicular child restraints and airbags. Over the course of the last decade, their work has influenced policy across the nation, contributing to a dramatic decline in the number of children who are injured or killed in car crashes. I have asked our center to build upon this success to generate the same level of influence on issues related to violence prevention. This will require a large investment from our institution and a few guiding principles, including the following. We will understand and improve what works while rigorously evaluating new ideas to ensure that they will be effective. And we will develop partnerships and collaborations with the community to share best practices and develop innovative new approaches. We know that when we build a scientific foundation for this work, we are better positioned to impact policy. We also know that taking a bold stance is sometimes uncomfortable and comes with risk. CHOP does not engage in partisan politics, and I consider us politically agnostic. However, our work will prepare us to take a clear stand on issues when the science and practice of medicine compel us to challenge norms and assumptions. Having an impact on policy is not a new concept for the people in this room. We have done it successfully for many years. I'm confident by working together we can help advance policies that will reduce gun violence. We are here today because we want to reduce gun violence and save lives. This is a day for us to learn from each other and share ideas. Let's make the most of it. Thank you very much.